Hi, this is Dr. Eric Westman with Adapt Your Life, and it's been a busy few weeks for me, faced with the oncoming COVID-19 hurricane, if you will, or wave, noting that there were signals that masks or face coverings were helpful for people. We decided to embark on a program to help put face coverings on the people who can't get them locally. And so we had time to prepare, seeing that there were other epicenters happening in the US. We got local stitchers and some local companies that were changing their manufacturing into face masks to donate or give at very low cost their masks to people who were unable to afford them or unable to have social distancing, unable to stay at home. And so one thing led to another. It snowballed, and we've given out over 30,000 masks now in a metropolitan area of Durham, which is about 250,000. Very exciting to see this happening. And we even started a GoFundMe. Dr. Larry Greenblatt, a friend of mine, who got excited about this too, and we have almost $25,000 in donations. Of course, this is just scratching the surface of the need, but until other companies can give out or provide other face coverings, this is our attempt to help people in our area. So interestingly, along the way, now that there's some scholarly activity done looking at face masks, a study out of Yale looking at universal cloth mask adoption suggests, and it's a preliminary study, I'd like to see it done again, but it suggests conservatively that for every mask you use, you may save from $3,000 to $6,000. What most people don't realize is that a hospitalization is very expensive, and it ranges from $30,000 to $70,000 in ICU stay, even more than that. So by putting on these masks to prevent the spread of people who don't even know they have the symptoms yet, it's very powerful in terms of human life and in terms of cost savings. That's pretty exciting to see the scholars starting to look at what would happen if you did use cloth coverings. Not masks that are N95s and hospital grade. Those are for medical people. This is the face coverings for non-medical people. They still do work. So I do want to bring my area of expertise. Many of my patients are staying in place in Durham, in our area. The stay-in-place order is going to stay for a little while longer. And let me just talk about some basics of nutrition while you're staying in place. What's fascinating is that the basics of nutrition still apply. Let's see here. Have you noticed that while staying at home you eat differently? I'm still seeing patients, or talking to them. The Duke Clinic has been closed. Where I am has a bunch of different types of clinics, and we're not going to be back there for probably several weeks. So I've been doing phone consults and telemedicine, and actually a lot of people are doing great. If you were someone who went out to restaurants, for example, and could not have the dessert, those people tend to do better because they're not going out to the restaurants. If you're with a family that eats carbs and you have all of the stresses of working at home, being with family, the carbs around the house, these people tend to not do so well sticking to a low-carb or keto diet. But I want to make sure that you remember, if you come through my classes, you'll hear me talk about this before, but in terms of the macronutrients that you eat, the sugars, starches, the proteins, and the fats, protein comes first. So if you're in a situation where you don't have access to much food, what you want to do is focus upon having protein first. And you can have an example of this. So in my obesity medicine world, weight loss world, we focus on higher protein, lower carb diets as my area of expertise. But if you think of someone who goes for weight loss surgery, people are advised to eat protein when they come out after the surgery. So protein is the most important macronutrient to eat. And also, I don't worry so much about people who have extra fat on their body when there is a limited amount of food. And I know this doesn't come out right, but I talk to people all the time who are hungry, but they have plenty of access to fat on their body if their fat stores are accessible. So by cutting the carbs, focusing on protein coming first, the body gets access to the fat store, the hunger goes away. That's what I see in my clinical practice. And if you have a loved one who is unable to get food or has hunger, but they have plenty of fat stores on their body, I don't worry so much about them. I mean, yes, it's terrible that you have to have hunger and deprivation, but it's not a life and death situation. But the first thing to remember is protein comes first. So what are complete protein sources? Eggs are fantastic. Fish and seafood, poultry, meat, cheese, nuts. These are the sources of food that give you complete proteins, and I don't worry so much, even if someone's trying to lose weight and restricting what they eat. I focus on these foods as the sources to go for first. So with basic nutrition, even when you're staying at home or in times when there's scarcity, protein comes first, and that's just basic nutritional principle. So in our area, most of my patients are still on a stay-at-home order, but you can actually find your own local information. And what's fascinating about this pandemic is that it comes in different waves, different epicenters, and different tempos. And so while we were watching different epicenters in different parts of the country, we were able to prepare in April, early April. And this is the deaths in North Carolina. And you can actually get this information from the New York Times, from the North Carolina Department of Health and Human Services. And I made my own graph in just a simple PowerPoint presentation, looking back at all of the numbers for the deaths. And in our area in North Carolina, the number of deaths per day, the number of cumulative deaths is still going up. So this is the number over time. The best advice from the medical experts, the epidemiologists, and those who have followed pandemics is that you don't want to go out into society when this is still happening. So I've been advising my patients, and many of my patients have heart disease, diabetes, obesity. They're at high risk for problems if they do get COVID-19, is to still stay at home until we follow our local trends, until the local trends are going down. So the risk right here is going down. And we're not seeing that yet in our area. But again, follow your own area. The New York Times has a easily accessible website that has this information. You might follow the Johns Hopkins data as well. And I guess I'm going to join the call of many of the people today asking, where is the U.S. Centers for Disease Control in terms of showing us data and giving advice for what to do? I would like to see a daily briefing from the medical experts and epidemiologists to guide us through this pandemic. That's my view, and of course I have almost a face mask for every day. Some of my friends gave me fabric to make different face masks, and these just pop in the hot wash cycle and dry them, and then they're ready to use. And I don't wash them every day. The idea, this is not protecting. I'm not going into areas where people have, or I know they have COVID-19, like in a hospital. This is to help protect the spread from me to others and from others to me when they don't know they might have it. It helps me to not touch my face, to not give myself the virus if it's out there. These are just some tips that still are useful today. Remember, protein comes first. Face masks do work, and in our local environment, I'm still advising people to stay at home. I'm Dr. Eric Westman with Adapt Your Life. Please subscribe below, if you like, ask questions, and we'll get to them as we can. Thank you.